Hello, my name is Paul Dajcik. Today I would like to talk to you about the overhead pulling movement. The lat pull downs on the machine, assisted pull-ups or regular pull-ups. Very often this exercises, when done incorrectly, lead to shoulder pain. When you go to a gym and you have somebody train you or you see a training video, people say keep your shoulders down. Lately it became a cliche and everybody's saying it. Every trainer that you would see would tell you keep your shoulders down no matter what happens. Well, if that is done incorrectly, chances are you're going to injure your shoulder. And I've seen this happen to a lot of people. So let me explain what I mean. So let's say you're doing an overhand pull-up. You hold the bar, you lower yourself, and then you pull yourself back up. Okay? Notice what's happening in my shoulders. If I'm told to keep my shoulders down, this is as far as I can go. From here, to extend my arms completely, I have to allow my scapula to rotate up. If I don't, and I keep them down, I can't completely extend my arm. So if I'm going to extend my arm, what's going to happen is I'm going to pinch here. Then my acromion process is going to pinch on the long head of the bicep tendon or the supraspinatus. Okay? That's usually what happens. So once again, let's pretend that this arm goes all the way up. I allow my scapula to rotate up, okay, and elevate. This one I don't. Okay? So in order to compensate for this movement, what I actually end up doing is pinching here, and I increase the mobility of my shoulder joint to compensate for lack of mobility in my scapula. So at first you do this because you're told to do this. You keep your shoulders down as much as possible. However, when you feel the pain, sometimes you will instinctively actually let your scapula come up to prevent the impingement from happening here. Okay? But after a while, the muscles that hold your scapula down and rotate your scapula down, those muscles are going to get tighter and they're going to get shorter because you're always contracting them under a lot of resistance, and they're simply not going to let your arm come all the way up. You're just not going to be able to do this, even if you wanted to. However, you're not even going to think about it because you think you're doing it correctly, and every time you bring the arms up, you're going to try to move from here, having the acromion process press on the tendon of the lower head of your bicep or press on the supraspinatus. Okay? Now, most people do not think that injuries to the shoulder happen from the pull-ups or the lat pulls down. Most people think that the injuries to the shoulder happen from the overhead presses. And unfortunately, a lot of orthopedic surgeons and physical therapists have the same impression. So very often when people go to the physical therapist or an orthopedic surgeon or even chiropractor, and they say, well, you know, I have pain here, MRIs are taken, and then there's an inflammation or irritation or sometimes even a tear of the tendons, the first thing that you're going to be told is lay off overhead presses. So if you do handstand push-ups, you can't do those anymore. If you do a barbell or dumbbells overhead presses, you can't do that anymore. Any kind of overhead pressing movement you can't do anymore. However, most people are not going to tell you to stay away from pulling movement. Okay? Whether it's pulling this way, pulling that way, or pulling this way. So what's going to happen is, for a while you may feel like everything is getting better because this irritates as well. Pushing up irritates as well, not just pulling down. Okay? Remember, we're not talking about which muscles are doing the movement. We're talking about what happens when your acromion process can't correctly get out of the way and let the tendons do their work. Okay? So after a while you keep getting the pain. Now you're not doing any overhead presses, you don't know what to do next, and the doctor will most likely tell you one of the three options. Very common options. The first one is do not do anything, do not move your shoulder, and you may just do bicep curls and tricep press down and basic exercises. That's usually the first option. However, if the bicep tendon is injured and not the supraspinatus, and you do the curls, you may still feel the pain. Okay, so that would be the first thing. Sometimes the doctor will give you a rehabilitation routine and you might rehabilitate. And it's not even about the fact that you're working your rotator cuffs, it's about the fact that you're not having your acromion process press into the tendons. You feel better, you go back to overhead presses and lat pull down, and all of a sudden there's pain again. So that's another option. And of course the two other options is the surgery or the injection that's going to take away the inflammation. Well, the surgery, of course, it's a separate total issue, and the inflammation, you can take it away, but you're still going to be injuring the tendon. It's going to keep getting worse, worse, and worse, and you may not feel it for a while, and then it might be too late, and unfortunately you may have to do a surgery at that point if you go to the point of no return and the injury is too great. Now, if you have lateral scoliosis, your condition might even be worse. That means that if your spine a little bit turned to one side or a little bit to the other side, chances are, and this happens most of the time, if you have one side a little bit higher, the side that's lower, that's where you're going to feel the pain in your shoulder. And that happens for many reasons, but two most important ones is, number one, if that shoulder is lower, chances are you already have tightness in the muscle that moves the scapula, and they're going to keep it down. That's number one. Number two, of course, where this arm is a little bit closer to the bar, this arm has to overcompensate at the shoulder joint. So it's not even the fact that the whole scapula is not rotating up, although that probably is the case as well. Now you have the body leaned over to the side, and you have to move it up more. Okay, so that's what happens if you have side to side. Now the question is, should you tell your clients, or should you tell people that you train, or should you do it yourself? Should you keep your shoulders down? Well, shoulders down advice started when there were people that were using the machines with little weight, and this was the movement. The shoulders were being kept up, and this was the movement. And the goal was to get the shoulders down towards the lower part of the movement. Okay? The goal was not to keep them down over here. Yes, you need the mobility in your scapula. Okay? It's supposed to move. It's not just supposed to be a shoulder joint. Your scapula is supposed to move with your shoulder joint. Okay? So the advice is great, keep the shoulders down, but try to get them all the way down when the bar is coming down here. Not try to keep them down as the bar is up here. So now for the last part, what happens if you do have the shoulder injury? How do you solve it? Well, the automatic response is not to stretch. I study stretching myself, and I've been studying for a long time, and I've been practicing different forms of stretching, and I believe in stretching when it's a correct option, but it's not always a correct option. However, lately a lot of people got into stretching, and stretching became the magic bullet, and the answer to everything is stretching. The muscle hurts, stretch it. The muscle is tight, stretch it. The muscle is irritated, stretch it. Well, in this case, very often it does not work. Okay? Because the goal is to release the muscles that are holding the scapula down. Okay? Sometimes the goal is to release the muscles that are flexing the spine to the side. Okay? So stretching by itself does not necessarily work. And if you have irritated muscles, inflamed muscles, and you begin stretching them, overstretching them, that could actually do more harm than good. Okay? So the first thing that you would do, you would actually rest, give a little bit of time so the muscles are not inflamed anymore, and then after that you would massage the muscles and slowly begin to work on the range of motion. When the range of motion is improved, then you could start doing the movement very carefully, keeping your mind on the fact that your scapula is supposed to move. Okay, your scapula is supposed to move as your shoulder joint is moving. Okay, and then after a while, you're going to be able to do it correctly, and you're going to be able to do it correctly without pain. This goes for overhead pressing. This goes for overhead pulling.